Hey everyone, and welcome to a deep dive that's really important, I think. We're going to be talking about autism and anxiety together. You've sent in some really interesting research on this, and I'm really excited to get into it.
Yeah, it's a really interesting area, and
Yeah.
it deserves a lot of attention, doesn't it?
Yeah.
I think the more we can kind of look at these connections, the more we can really support people who are navigating both of these things.
Yeah, definitely. And I know you guys listening already know a bit about autism and anxiety, so we can kind of skip over the basics and just jump right into it. When I was going through this research, it really struck me just how much these conditions can intertwine, almost like you're weaving them together.
Yeah, that's a great way to put it. Sometimes it isn't clear cut, is it? And that can be tricky, when you're thinking about diagnosis and the best way to support someone.
Absolutely. And one of the sources that you sent in, I think it was that study from the Journal of Autism and Developmental Disorders. That one really stuck with me. It talked about how anxiety for someone with autism might not just be, general worry, but it could be a very particular fear tied to their routines if something changes unexpectedly or even just different sensory input, stuff like that.
Yeah, and that's really, really important. We need to move beyond these broad definitions and actually think about what it's like to experience this. We
Yeah.
can't just say, oh, anxiety is common in autism. We have to look at why. Why is that person feeling anxious? What causes it? And how is that different from someone who might have anxiety but isn't autistic?
Right, like a social situation that might make some people a little nervous. But if you're autistic and dealing with sensory overload on top of that, and you have trouble reading social cues, it's different. Then you add anxiety on top of that. That's a whole other thing.
Exactly. You have to remember that anxiety can show up in ways that are directly connected to autism.
Okay, so we're talking about social situations. What other things did you find in the research? What else is connected?
Well, one thing that's really important is emotional regulation. That's just how well we can manage our emotions and our responses in a healthy way. And we know that people with autism and anxiety can both struggle with this. But the reasons why they struggle and how that actually looks can be different.
Okay, I think we need to break that down a little more. Can you give me an example of how emotional dysregulation, is that how you say it?
Yeah, that's it.
How would that look different in someone with autism?
So imagine a child with autism, right? And their routine is disrupted. That can lead to a meltdown.
Yeah.
You're shouting, crying, even physical outbursts. And it might look like a temper tantrum, but it's not. It's not a way to manipulate the situation. It's a real response to their environment changing. It can be really overwhelming. They might be overloaded with sensory input, and they might not even have the communication skills to explain how they're feeling.
So it's not just about the behavior, right? It's about understanding why they're doing it.
That's right. Now, on the other hand, think about a kid having an anxiety attack. They might cry or have trouble calming down too, but the trigger is totally different. It could be that they're afraid of being away from their parent or caregiver, or maybe they're worried about something that's going to happen. The emotion is different, even if the behavior looks the same.
And that's where it's so important to understand the nuances, right? If we don't understand those emotional responses, then we can't respond in a way that helps.
I agree 100%. We can't just look at the surface.
Okay, so we've got emotional regulation and challenges with social situations. What other intersections did you see in the research?
This is interesting. Both conditions can affect executive functioning.
And just quickly, executive function, that's like our brain's management system, right?
Yeah.
Planning, organizing, focusing, all that good stuff.
Yeah, exactly. And both autism and anxiety can mess with that, but in slightly different ways. Someone with autism, for example, they might struggle with cognitive flexibility. That's our ability to switch between tasks or think about things differently, like they get stuck on one idea or a way of doing something. That makes it hard to adapt.
Yeah.
When something changes, it's difficult.
Which could actually trigger anxiety too, so it's like a double whammy.
Exactly. And then if you look at anxiety, someone with anxiety might struggle with working memory. That's just remembering information and using it. Have you ever felt that brain fog when you're anxious?
Oh yeah, all the time.
Right, they can make it hard to concentrate, follow instructions, or remember things.
Your brain is trying to work overtime, but it's being bombarded with worry and fear at the same time.
Perfect analogy.
Yeah.
And you can see how these challenges can have a domino effect.
Right.
Academics, social stuff, everyday skills, it impacts everything.
Yeah, you're right. It's not just a concept. It affects their whole life, how they feel, their quality of life.
That's right. And that's why it's so important to understand how autism and anxiety work together. Then we can give people the support they need. And that's why the research you shared is so helpful. When we understand those specific overlaps, we can start to come up with better ways to help, more targeted ways.
Okay, so let's talk about those interventions, those ways to help. You said that you can't just use any anxiety treatment on someone with autism, right? It's not one size fits all. Why is that?
Okay, so let's say you're working with someone who has autism and they have a phobia of dogs.
Mm.
A typical CBT approach, cognitive behavioral therapy, might involve slowly introducing them to dogs, starting with pictures, maybe, and then working up to actually being around a dog. But what if their fear is really about their senses? Like the way a dog's fur feels or the sound of it barking is just too much. If that's the case, exposure therapy might actually make their anxiety worse.
Yeah, that makes sense. It's not just the fear itself, it's how that fear is connected to how they experience things through their senses.
Yeah. So you might use sensory regulation techniques along with the therapy, like maybe teaching them to use deep pressure touch or give them noise-canceling headphones to help them manage during those exposures. It's about tailoring the intervention to that specific person and how their autism and anxiety connect.
So it's like you're making a custom treatment plan for them, not just using something generic.
That's a great way to put it. And that's important for everything, not just therapy.
You're right. And it makes me think that we need to understand the differences between autism and anxiety just as much as the similarities.
You got it. Because they do have a lot of things in common, those shared challenges. But autism and anxiety are fundamentally different. They each have their own characteristics.
Okay, so let's talk about those differences. You mentioned that they come from different places, different root causes. Can you explain that a little more?
Sure. So autism, we've talked about this a bit, is a neurodevelopmental difference. It means it's there from birth. It's how their brain is wired. Genetics are definitely a big part of it. But how genes in the environment work together, that's something researchers are still trying to figure out.
So it's literally a different way their brain works, a different way of experiencing the world.
That's it. But anxiety disorders, they usually come from a mix of different things. Genetics can make someone more likely to develop anxiety, but your environment also has a huge impact. Stressful things that happen in your life, trauma, what happened to you as a little kid, even things you learned can all play a part.
It's like a recipe with a bunch of ingredients, right?
Exactly. And that's why you can develop anxiety at any point in your life. Sometimes it's triggered by something specific that happens or a big change. It's not always a lifelong condition like autism is, although it can be chronic. It depends on the person and what kind of anxiety they have.
So different origins. What about the actual symptoms? How can you tell the difference between autism and anxiety? Because like we said, sometimes they look the same from the outside.
Right, and that's why it's so important to look deeper. With autism, the main symptoms are about social communication, having those restricted interests and doing things repetitively, and sensory sensitivities. Those are the core things that make up the diagnosis.
So it's not just being a little different or shy. It's
Yeah.
much more fundamental than that. It changes how they process information, interact with other people, experience their senses, everything.
Exactly. And you see these differences pretty early on, even if people don't always recognize them right away. Anxiety, on the other hand, is about excessive fear and worry.
That feeling of dread that you can't shake.
Yes. And that can show up in a lot of different ways. Physical things like your heart racing or sweating, changing how you act, like avoiding things or being restless, even how you think, like trouble concentrating or having thoughts you don't want.
So what's happening on the inside is different from what you see on the outside.
Right. You got it. So someone with autism might do things repetitively or have a hard time making eye contact, and people might think they're anxious or shy. But those things might not be coming from anxiety at all. It might be that they're having a hard time understanding social cues, or they need that sensory input.
So don't jump to conclusions based on what you see on the surface.
Exactly. That's why it's so important to get a real assessment from someone who knows what they're doing, who understands both autism and anxiety.
Someone who's looking at everything, connecting all the dots.
Yes. And it might take a little time, but it has to be thorough to get it right.
Because if you get the diagnosis right, that can change everything.
Right. You can find the right support, the right therapies, the right accommodations. It can validate what they've been going through. That's powerful.
It can make them feel seen and understood instead of lost and alone.
That's what it's all about.
So we've talked about how important it is to get the diagnosis right and have the right interventions and understand those connections. But what does that actually look like? Can you give me some concrete examples of those interventions? What are people actually doing?
So we talked about CBT, cognitive behavioral therapy. That can be really effective, but you have to change it up a bit so it works for people with autism.
Yeah.
There's a type of CBT called CBT-ASD. It uses visual supports, social stories, and other strategies that work really well for autistic people.
So you're taking the same ideas, but explaining them in a way that makes sense for someone with autism.
Exactly.
Yeah.
And it's not just what you're saying in therapy, it's the whole environment too. You need clear communication, a predictable routine, and you have to think about their senses. Therapists who are good at working with people with autism, they know that.
It's about making them feel safe and comfortable so they can really open up.
That's it. And it's not just about therapy either. There are tons of other interventions that can help.
Like what? Give me some examples.
Well, if someone's autistic and has social anxiety, social skills training can be really helpful. It teaches them practical things like how to start a conversation, how to read body language, just how to navigate social situations. And it's all done in a safe space.
So they're learning tools and strategies they can use.
Yep. And we can't forget about those sensory regulation techniques we talked about.
Right, like the weighted blankets, noise-canceling headphones, fidget toys, all that.
Yeah. All those things can help them manage what you're feeling, especially if sensory overload is a big trigger for their anxiety.
So they can take control of their environment, and that helps them manage their emotions.
Exactly. And this is where it's so important to work together. The therapist, the educators, the person themselves, their families, everyone, figure out what works best for them.
Don't try to force them into a box. Honor their needs and what they like.
Exactly. And that leads us to another really important thing, creating supportive environments.
We've talked about sensory-friendly spaces, but what else does that include?
Well, you have to remember that autistic people really thrive on predictability and routine.
Right, the visual schedules, the social stories.
Those things help reduce anxiety by making them feel safe and secure, like they know what's coming next. But it's more than that, too. You want to create a culture of understanding and acceptance at home, in the community, everywhere.
So you're saying we need to make people feel safe and understood, not just their senses, but like the whole environment needs to be predictable and make sense to them.
That's it. And that's where these bigger changes need to happen.
You're talking about including neurodiversity more in schools, at work, everywhere, really. And challenging those stereotypes about autism and anxiety and making sure people can get good support, too.
Yeah, exactly. We can create these little bubbles of support at home or in classrooms, but we need everyone to be on board. We need a world where it's normal to be neurodivergent, where it's celebrated, not something people are afraid of.
I love that. And to do that, we need more people to understand, right? We have to talk about this stuff more. Get rid of the stigma.
100%. The more we talk about it, the less alone people feel.
And we need to talk about misdiagnosis, too, because you mentioned that's a big problem when it comes to autism and anxiety.
Yeah, it's a huge problem.
And it can go either way, right?
I-
Someone might think they're anxious when they're actually autistic, or the other way around.
Yeah, you're right. And getting the wrong diagnosis, that can have a huge impact. Imagine going to therapy for anxiety for years, and then you find out it was actually undiagnosed autism all along. Or a kid who's labeled as a problem because people don't understand they're actually anxious. It's really sad to think about all those people, those families, who are struggling because they don't have the right diagnosis, the right support.
It's heartbreaking. So how do we fix this? How do we make sure people are getting the right help?
Well, it starts with teaching people. Healthcare providers, teachers, everyone really. We need to teach them about autism and anxiety, how they're similar and how they're different.
So they know what to look for, those signs, and they can send people for the right tests.
Right. And then those assessments, those tests, they have to be really thorough. It's not just about what you see on the surface. You need to get information from different people, parents, teachers, everyone who knows them well. And you have to make sure it's not something else entirely.
It's about looking at the whole person, their whole life, not just checking off boxes.
Yeah, exactly. And it might take time, but you have to get it right.
Because when you do get it right, it can be amazing. They can get the right help, the right therapies, just feel understood. That can make a world of difference.
Absolutely. It can change how they see themselves.
And that's what matters, right?
Right.
That everyone can live their best life no matter what.
I completely agree.
I think that was a great conversation. We really dug into this. We talked about how complex autism and anxiety are, how they overlap and where they're different. And we talked about how important it is to get the diagnosis right, the right support, the right environment, all of it.
Yeah, it was a really good discussion.
It was. I hope everyone listening got a lot out of it. Remember, the more you know, the more you can help. Keep asking questions, keep learning, and keep talking about this stuff. We can make a difference together. See you next time.